Hi, welcome once again to Senior Focus. I'm your host, Bill Adams. Senior Focus is a show designed for folks over the age of about 50 or so. But of course, at any age, we hope you find some information you could use for your daily life, or you could share with your family and your neighbors. Before we get started, I want to thank Greg Roten from Armstrong's Channel 20, and also Keith Kaiser from the Mill Creek Metro Parks, who allows us to use the Davis Visitor Center to film the show. And today we're going to be talking with folks from the Joanie Abdu Comprehensive Breast Care Center in Youngstown at St. Elizabeth. And I'll introduce our panel from my direct right, or the left as you see, is Dr. Rashid Abdu, and to his right is Nancy Gant, doctor with the Breast Care Center, and Julie Dulay, who is the manager of the center. I want to thank you all for coming in.
You're welcome.
Thank you for inviting us.
Well, we're really happy that you're in because, as we were talking a little before the show, so many folks in the area, not only women, but families are affected by breast cancer. And it's wonderful to know that this center is here in the Youngstown area. And I thought what we would do is maybe start, Dr. Abdu, with you describing your history, with your wife, and how you came up with the idea of having this wonderful center here in the Mahoning Valley, and just the genesis of this, and then we could talk about some of the services that are offered.
Thank you. In 1993, my wife came down with a breast cancer, quite an aggressive form. And we were going, like many women in this valley and elsewhere, between Pittsburgh, Cleveland, Youngstown, trying to find something. And as women also, who were coming to my office, going to other offices, I mean, that's just how it was. There was nothing, no centralized area where they can go for comprehensive treatment. And then I learned there was a comprehensive breast care center in Long Beach, California. So I took off and I spent there 3 days, and I was so impressed with their program. Came back here, I promised my wife, Joanie, that someday we're going to have a comprehensive breast care center in this valley. So our women don't have to run all over the place and in order to find the best care they can get. And then we started, and it took 18 years, but it was worth the effort and worth the ups and downs, frustrations. We have it done. The community embraced it, from the very old to the very young, from the very rich to the very poor, and now we have it. It was interesting. I was reading in the Vindicator this morning, and they talked about the commitment of folks now in this valley to breast cancer and the treatment of breast cancer. And they called the Joanie Abdu Comprehensive Breast Care Center the crown jewel of that commitment.
Isn't that something?
And I think that's true.
Well, and you're coming up on 3rd anniversary, I believe?
Yes.
And when? What's the date on that?
We opened the 2nd of November, which was my first.
So that's a special birthday gift, isn't it?
Yes, it was. The best gift I ever had or will ever have.
And of course, every year you celebrate that with the anniversary.
Absolutely. Every day is a celebration in that center, just to see these women come in and so happy. That's why we have approval rating of 99%.
99% approval.
99%. That's why we're getting all those awards.
It's the crown jewel of approval for the hospital system.
That's tremendous.
It is.
Yes.
Yeah, I would think of all, you think of any department of a hospital, of course, some people are going to have a bad experience. It's just, human nature, but 99% is very impressive.
Yes.
And one of the things, before we, go on and talk with maybe Dr. Gant, I want to ask about your commitment to, as you said, all the people, rich and poor. This is designed for folks who may not have the financial resources. Is that right?
Absolutely. Because not only is from the humanitarian aspect, but this is consistent with the mission of the Sisters of the Humility of Mary, who started St. Elizabeth and everything else that we have today.
Right.
And is to help the poor and underserved. And one of the reasons that we reportedly have among the highest mortality rate from breast cancer in the nation and in the state.
Right.
Is because we have so many poor women who lack the resources, lack education, and they come late, and then they die early, and contributes to the higher mortality. So as a result, we started what we call, we started Joanie's Promise Fund. And that's where the money from the Panarathon, which was very successful, thanks to the Cavallis
Sure.
and to the community. 10,000 showed up.
Isn't that
This
amazing?
year, yes, and we raised more than $275,000.
Wow.
And it goes to help these women so they can get the best care regardless of their economic status.
Right.
We hired a full-time community liaison, Kathy Marini, wonderful lady. And she goes to outreach to educate these women about breast cancer, self-examination, importance of early detection, and we help them with everything they need so they can get the very best care anywhere in the country.
And it's right here, again, in the
Right here
Mahoning
in
Valley.
Youngstown. As a result, in fact, because of the excellence of this center, now instead of women leaving our valley going elsewhere, we have in fact now women from elsewhere come to our breast center.
And Dr. Gant, we were talking a little bit before the show about the atmosphere, and you were describing, just how
It's a wonderful place. It is calming, it's serene. You drive up, there's parking right there that's free. There's an elevator or steps going upstairs with a water feature. They've tripled the size of the healing garden outside. It rivals Fellows Riverside Garden as far as being a beautiful, peaceful place, especially right now with all the new pink mums in, and water features and a swing and memorials to many people where people have contributed. The staff is welcoming and calming. The front part is reserved usually for the male gender, the male people that come in with our patients, although we do have male patients come in the center. Men still need to get DEXA scans for breast density, and if a man has a breast mass, they need mammograms and ultrasound. So we've got the logistics all set up for that also. But from the staff who are so supportive to the fluffy little robes that women wear, to Keurigs everywhere with coffee and tea. The thing about our center is we really treat each patient very holistically. We see more patients there for screening mammogram than anything else. It's not just a place to come if you have a problem. It's a place to come for your screening mammogram. And what is so wonderful about it is that if our radiologist or our incredibly skillful mammotechnologist, if they notice something on your mammogram, they're going to march you right through to biopsy that same day. Most women, either women that work or women that come in that have arranged for childcare, they've already blocked out some time. It's really not convenient to block out more time in a couple of weeks, plus the anxiety that produces having to come back in for additional testing.
Right.
So when you come in, even if you just come in for a screening image, if there's something that's not quite right, we'll march you right along, get everything done before you leave the center that day. So you'll be well on your way to and often, very often, our patients get an answer that very same day. They meet with our breast navigator. They've got tons of information when they leave. And really, we keep that anxiety level so low. It's miraculous, it really is.
Yeah, so that's a key feature, as you were just talking about, the speed at which you'll take more than one step at the original step. Because again, I would think the old way of doing it, I guess, or where it may be the way it's done in many other places is, as you said, you come in one day, then you wait a few days, or you wait a week, and then you get scheduled for something else. And that would all add up, especially, again, a lot of times you'll find out good news, and people will hear that fairly early on, so they don't have to, be worried and nervous for a long period of time.
It really allows women to manage their health. And we also emphasize, we're not just emphasizing breast health, we're emphasizing all health. We've got all sorts of discussion and information. We talk about genetic risk. The mammotechnologists assess our patients to see if they should have genetic testing, because as we're learning, there's more and more of a genetic component to breast disease and other diseases. We emphasize fitness, weight loss, stopping smoking. So we treat our patients very holistically there at every level. It's tough to walk in the door and not be told some way you can get healthier.
Well, we probably should have done this at the beginning, but maybe, Julie, you can give the contact information, phone number, if people want to contact the center. And I know you have a separate number for a mammogram if they want to schedule.
Well, we actually have one scheduling number for the facility. It
Okay.
is 330-480-2654.
Okay.
We also have a main number if someone just has questions or would like information or to speak with our navigator. And that main number is 330-480-2555.
Okay, and of course, you're located actually right on the campus of St. E's, correct?
We are
Yeah.
directly behind the main hospital,
Okay.
downtown Youngstown. The address is 1044 Belmont Avenue, but our facility actually is on Park. It's across from the parking deck, and most people are familiar
sure,
with
yeah.
that.
Parking
So-
deck, yeah.
Right, right.
Easy to find.
Right. And maybe you could talk a little bit, Julie, about the team approach, because you're the manager of the overall operation, is that correct?
Correct.
And in going online, I saw that there are daily meetings. If you want to talk about it, or maybe either of you, the doctors want to jump in, but you have like a team approach, right?
We do.
With can you describe that, how that works?
Oh, absolutely. The center actually there's three main components to the center. We have a diagnostic imaging center. We have a surgical clinic where Dr. Gant sees all of her patients pre and post-operatively. We also have a medical oncology clinic where Dr. Kessler sees a lot of the oncology patients. We do have a strong interdisciplinary team approach. Our patients are seen by the technologist, by the radiologist. If they feel they're at high risk, we have a wonderful nurse navigator that Dr. Gann alluded to, Jill Townsend. She is on call 24 hours a day, 7 days a week. So once a patient is told they're highly suspicious for breast cancer, Jill introduces herself and she will help navigate that patient if they need surgical consult, if they need a medical oncology consult. Tremendous education at the center. The one thing that is very unique to our center is we have a wonderful conference. It's held every Wednesday morning. It is an interdisciplinary breast conference. When we diagnose a breast cancer, usually within 1 week, we hold that conference every Wednesday. That case is presented there. And the difference with that conference, it's really prospective. It's meant for a treatment plan. And we do have a radiologist, we have a pathologist, we have a surgeon, we have a medical oncologist, and we also have a radiation oncologist. So very early in the diagnostic process, we have a treatment plan for that patient from beginning to end.
I can't emphasize enough how important that is. The reason I'm a breast surgeon is because of interdisciplinary care. You know, the way most physicians practice, unfortunately, is in silos, where they
Right.
do their part and shawl you off to somebody else. Every woman, or if we had any men, which we do occasionally, that get diagnosed with breast cancer through our center, that case is presented the next Wednesday morning at 7 a.m. at our conference, which we have 100% attendance, either in person or through audio, or through GoToMeeting, so they can see
Sure.
all the images, by all the specialties. And there's often our genetic counselor there, the mammotechs are there, my nurse is there, my medical assistant is there, our research nurse is there. It is a packed room, and every patient is discussed anonymously, okay? And then Jill Townsend, our breast navigator, comes up with a standardized list of recommendations, and that's forwarded to the referring physician. So we're not planning on treating the patient, we're just following absolute national guidelines to say what is the absolute standard of care. And things change. I mean, we'll be looking and we'll look up and we'll say, oh my gosh, this patient needs an MRI. Have we considered this? Someone will chime in with another piece of information. And so the referring physician, whether it's a family practitioner, an internist, a gynecologist, whoever referred that patient, will get a letter and say, your patient's been diagnosed with cancer, and they're also invited to attend.
Okay.
So all the referring physicians are always invited to attend the conference where their patient's going to be presented anonymously,
Okay.
although they know it's them. But this piece of information is really invaluable for our patients, to have the information and know what the national standards are for care. As an example, one would think, okay, you get breast cancer, the next step is surgery. No, absolutely not, when you're hearing that from a surgeon. So, for example, there's a new drug for breast cancer that was released. We've really started using it in the past 6 months. It's called pertuzumab or Perjeta. So when we look at breast cancers, we look at receptors. We look at estrogen receptors, progesterone receptors, and another receptor. It's it's a growth factor receptor called HER2/neu, not HIM-TER-neu, HER2/neu.
Okay.
Okay, HER2/neu. And all these receptors they're like little proteins sticking out of the cells, the HER2/neu, like a little sea urchin. So cells that overexpress HER2/neu look like little sea urchins. In the past, we had a drug called Herceptin that targeted that little receptor. It wasn't like a chemo, it was more like an antibody or an antibiotic or something. Now we have this other drug, and the two of them just attack this receptor and disable the cell. We're only allowed to give it before a person's had surgery. But we've given it to many women now, and when I do operate on them, their tumor's completely gone. So when you have your 41-year-old mother of 4 boys, the oldest of which is 10, who comes in with a tumor the size of her fist and great big lymph nodes, it just snuck up on her.
Oh, boy.
You give her these drugs, she gets chemo, she gets those other drugs that are like antibiotics, and I operate on her, and there's no visible tumor left. It's phenomenal. If she had gone directly to a surgeon that had simply done the surgery, which would have been a mastectomy and a complete lymph node dissection, she could have never gotten that drug. So it is really important to start at the very beginning before you've burned any bridges,
Right.
and figure out what the right thing is for that patient. It really is the standard of care.
And I guess, Dr. Abdu, one of the things we want to talk about is early detection and
Very
encouraging people to go for mammograms so would it be a good idea, just to contact, you have the public education person, you said, community education.
Yes.
Will that person go out to speak to groups?
Yes.
Is that
Yes.
okay?
She goes to these underserved areas, and we hope that next year we may have even our next step is a mobile unit
Okay.
to go to these places. So we're going to have to raise money for that, and I hope that
Yeah.
the money from the Panarathon next year will go for the mobile unit, so we can go to them, make sure every woman has the best chance of getting the best care.
A lot of women are fearful of coming to a hospital.
Yes, of course.
Yeah.
And I just must add, I think one of the greatest thing in that center is 2 ladies, but Dr. Gant is, I think, one of the foremost knowledgeable, compassionate breast surgeon I have ever seen. And I've been here for a few years, as you can see. Really is. She's not only technically expert, but as you see, she's the latest. She's in national organizations. She's just incredible, and we are just so happy when I wish somebody. In fact, yesterday we had one of the TVs come and record our conference. It's an experience. It's the kind of conference that tells you in the simplest term, we measure 3 times but cut only once, and that's what Dr. Gant was telling.
That's a good way of putting it.
Yeah.
Sure. Yeah,
And
that's the old
because
carpenter.
In the past,
Yeah.
in the past, and yours truly, many times, in the past, you go and you remove the tumor, and then the pathologist said, well, there was a little bit left. Then you have to go back again.
Oh, boy.
We don't do that anymore.
We
Or
try
in
not
this
to.
case.
We try really
Right.
hard not to.
So
Right.
it's very, it's as the Vindicator said this morning, is the crown jewel in the region.
Getting
Well-
mammograms is a hot topic. It's a very hot topic. The
Okay.
United States Preventative Task Force Service came out in 2002 and said that every woman after age 40 should get a mammogram. And they didn't have a stop date. They just said that. Well, then in 2009, they came out and said that mammograms should be done every other year from age 50 to age 75. Well, there was a firestorm. It was big. It was like the burning of Atlanta. It was a big firestorm. So their next statement, their cover-up statement after that was, well, if you were 40 or older, you should have a conversation with your primary care physician or the ordering physician to look at the risks and benefits of mammography. Well, we all should spend more time talking to our doctors, but doctors don't often have all that time to talk. So
Sure.
it's a little bit of a muddy water right now. Most of us are still sticking to the American Cancer Society guidelines and the American College of Surgeons and the American, Society of Breast Surgeons, which are your first mammogram should be at age 40. If you have a family history of breast cancer in anyone under the age of 40, your mammogram should start 10 years before theirs.
Okay.
So if your sister or mother had breast cancer at age 41, you better be in there getting a mammogram at age 31. Okay? And also, anyone under the age of 45 who gets breast cancer really should be considered for genetic screening.
Okay.
Then, mammograms actually, in a average risk person who's had a completely normal mammogram, do not have to be done every year. They don't. However, most women will have a lump, they'll have denser breasts, they'll have some family history. Those women do need mammograms more frequently.
Okay.
Mammograms need to be digital. The old-fashioned plain film mammograms just don't show us the detail we need. And all the imaging that we do is not only digital, but we also have something called 3D tomosynthesis, which is like a CAT scan of your breast.
Okay.
It's almost magic, where you can see inside the breast, and that really reduces our callback rate to a very, very low number. Women don't need mammograms once they're in their 80s. The research has found that if a woman finds a tumor in her 80s or gets a mammogram and finds a tumor, because those tumors are generally slower growing, it doesn't really change survival.
Okay.
Because of the biology of the tumor, which we were talking about earlier. So, there's a lot of discussion now. It's not a rote guideline. So it is something that a woman should discuss with her physicians, both when to start getting imaging and when to stop getting imaging. Because we don't want to overtreat patients either. We want to treat the whole patient. We just don't want to treat their breast.
And Julie, I think you've all talked about the patient navigator. Is that something that's sort of a newer idea? But it sounds interesting that you've got somebody to sort of walk people through this and maybe go over some of the things you were talking about, Doctor.
Oh, navigation is a wonderful concept, and we also have oncology navigators, and Jill is our breast health navigator. The role is critical. It provides patient education, and oftentimes truly supports the physicians. Much as Dr. Gann alluded to, sometimes time is an issue with the physician's schedule.
Right.
Jill is an amazing person with tremendous knowledge to fill that gap. She
great.
reinforces the information that has been provided by the physician, and many patients are hesitant to keep calling a physician with questions. They feel very comfortable calling Jill.
At all hours of the day and night.
Even on vacation, and she doesn't mind at all. But they do create that relationship, and it's a relationship that continues after surgery, and she will help transition them to oncology. It's just an amazing service for patients.
It's actually mandated by the Commission on Cancer that there are navigators for every diagnosis of malignancy. So at Humility Mary Health Partners, we are hiring several more navigators. We currently have head and neck cancer, colon cancer, and breast oncology navigators, and we're moving right along and hiring navigators for all our additional high number malignancies. So, prostate cancer will be included in that also, and also the blood malignancies. So, it's mandatory and it's essential because it's so complicated, especially in this world of reimbursement, insurance, and how expensive a lot of the newer oncology treatments are. It can be very challenging to get access to those.
Well, and I don't know if we've...
Well, navigator is, it's just what we mean, navigates through the maze of all the complexities in these programs. But one example, for example, a lady came from down south with 2 kids. She was in shelter, she was homeless.
Oh, boy.
And a lump was found, and it was cancer. And Jill found her, not only navigate, but found her an apartment to live with her children.
Oh, that's tremendous.
Oh, yeah.
Interdisciplinary team approach. She worked with the social workers to meet all of those needs, to find support for the patient as well as the children. So it was a great story.
Well, and I just want to throw a little plug in for my own organization, if I could.
Yes.
Again, in my real life, I work with Access Health, Mahoning Valley, as we were talking before the show. And just so people know, if folks who are between 18 and 64 who need treatment, medical treatment, Access Health assists people in finding volunteer doctors and dentists and other treatment. We also help people sign up for newly expanded Medicaid. So again, we've worked with HMHP and with the Joanie Abdu Center, I know, to refer some people. And so again, there are services out there, and that's the key thing we want to let people know is don't let your financial situation stop you from ever, trying to get medical care.
Right. And we've got a financial counselor in the Joanie Abdu Center. So we've got someone sitting right there that is just an expert. And once again, with Kathy Mariani and working through with Joanie's Promise, that covers everything from your screening mammogram up through biopsy. And once a woman is diagnosed, there's HCAP, there's all sorts of, if she's not already enrolled in the expanded Medicare problem, we can generally find the right niche to get a patient coverage. There is a lot available.
Well, Doctor, we have a few minutes left, and going back to maybe again the start of this, from your own experience with your wife, I don't know that we mentioned, but she was a head nurse for many years, about 20 years with St. Neve's?
Not all the 20 years, but part of that time, yes, she was a head nurse. She was a head nurse. Lovely lady. I only regret that I cannot push the clock back and have her now under the care of Dr. Gant. She would have been alive.
Well, we think she's looking down at the center and smiling.
Well, that's what I was going to say.
Yeah.
I'm sure that
Yeah.
she realizes what has
yeah.
come to pass over the years, and
She likes the
and
garden.
is a guiding force as you have been. But it's a tremendous effort that you undertook, and again, it's celebrating its 3rd anniversary coming up November 1st. Why don't we give out some contact information again? Anyone, but Julie, if you want to, Jewel.
Absolutely. To schedule, 330-480-2654. For any questions, information, please call the main desk, 330-480-2555.
Okay. And one other thing we didn't mention, we have a couple minutes ago, but Dr. Gant, you actually were a patient yourself at one point.
Yeah, I had breast cancer, 2006. I work on denial because I just managed it. But I did go out of town for my care. I needed a little bit of privacy. And the one person who in town I'd been teaching how to do sentinel node biopsy, if I had asked him to operate on me, I think that would have been an awkward thing for him. He would have been really nervous.
Right.
So I did go out of town for my care, but I certainly wouldn't do that again.
Yeah.
It really gave me a lot more understanding of what people go through. Obviously, as a surgeon and a German, strong personality, I'm going to go through things differently than other patients, but everyone goes through it their own way, and we just facilitate, we just help people so they can get through the process in as positive a way as possible.
Right.
Well,
Well,
treating patient also, with compassion, with understanding. Everyone in that center is trained to treat every single one with this kind of, as a human being that deserves the best. A lady tapped me in the mall on the shoulder. She said, "Doctor, I have no job, I have no insurance. I heard about Joanie's Promise, and they treated me like a queen," as tears were coming down her face.
wow.
Yes.
Well, that makes it all worthwhile, all
That
the
makes
work.
it all
yeah.
worthwhile.
Well, thank you all again. We've been talking with the staff of the Joanie Abdu Comprehensive Breast Care Center. It's at St. Elizabeth Hospital on Belmont Avenue. It's, as we said, the crown jewel of medical care, I guess, in this area, especially for women who are undergoing breast cancer or, just want to check to make sure. And so please contact them at 330-480-2555 for more information. You've been watching Senior Focus. I'm your host, Bill Adams. And we want to thank Greg Roden from Armstrong's Channel 20 and also Keith Kaiser from Mill Creek Metro Parks for allowing us to use the beautiful Davis Visitor Center. Until next time, thanks for watching.